Well, it's been a very exciting, Ash, for non-Hodgkin lymphoma, in particular diffuse large B-cell lymphoma. So the major study in the first-line space that we saw presented as a late-breaking abstract was the POLARIX study. And the POLARIX study was comparing in a randomized fashion R-CHP with polar R-CHP, in other words, replacing the vincristine with Polatuzumab vedotin, the anti-CD79B antibody-drug conjugate. This was a big study, over 800 patients, randomized, double-blind, placebo-controlled, so run very well in that respect. And the primary endpoint was the standard progression-free survival. So in many ways, a fairly straightforward trial to interpret. It included patients with slightly higher risk disease, so IPI 2 to 5. And what we saw was a positive study. Now that's pretty amazing because there's been many R-CHOP plus R-CHOP X studies which have been negative. And there was essentially a 6% prolongation in the 2-year progression-free survival. Now, that was statistically significant. The argument, of course, will be, is that clinically significant? And we did not see an overall survival advantage presented, albeit the study wasn't powered for that, and it's relatively short follow-up. It's the first analysis. So PFS advantage, which in diffuse large B-cell lymphoma is extremely handy because treatment at relapse is not very good on the whole, even with developments in CAR-T, etc. The outcome for patients at relapse is generally poor. So any sort of progress in PFS that translates into an improvement in cure, which was what we'd expect a PFS benefit to do, is welcome. And there was also a corresponding reduction in subsequent anti-lymphoma treatments, which again is what you would expect if that PFS benefit is real. So the big question is, is that a game changer? Are we going to change our standard of care? I think it's all going to depend on the reimbursement. If it's funded, then sure, why wouldn't you have it? The toxicity was basically the same as R-CHOP. So why not? But it's all going to be, I think, based on the health economic evaluations that are going to happen in the respective countries.